is August the 28th, 2014. This is the Eric Goodell Show. I am your host, Eric Goodell. Coming up, the White House prepares to go it alone on illegal immigration. Also, illegal immigrants are now being shipped all over the U.S., bringing with them undisclosed diseases, even into the public school systems. Let's go to this article on Fox News. Republicans sound alarm as White House prepares go-it-alone immigration measures. Because who needs Congress, am I right? Lawmakers are sounding the alarm as they prepare to return from the August recess over the possibility that President Obama will take sweeping executive action on immigration in a matter of days, with some Republicans warning of a renewed budget brawl if he takes that step. For all intents and purposes, America no longer has an immigration system. Instead, we have unsettling chaos, Senator Marco Rubio of Florida wrote in a letter. Yeah, because there are no outside threats to the U.S., so why not just have the border wide open? Earlier this week to Obama, urging him not to go forward with unilateral action. The administration has indicated the president plans to announce a decision around Labor Day before leaving on a trip next week to Estonia and Wales. But the administration officials told the Associated Press a host of national security crises have pushed the announcement back, likely until after Obama returns. A host of national security crises? I guess that wide open border is not looking very good right about now. Still, Press Secretary Josh Earnest signaled Wednesday that the White House is not backing off its general timetable. Asked whether Republican threats of retaliation would make the president think twice about taking executive actions, he said no, it won't. I mean, because he's the president, so he can do whatever he wants, right? I mean, there's no separation of powers or anything. Nothing the president does is a replacement for the kind of robust solution that passed with bipartisan support through the United States Senate. But the president is determined to act where House Republicans won't, Earnest said. The comments echo Obama's stated rationale for pursuing unilateral action, that Congress will not pass comprehensive legislation, forcing his hand. The most sweeping, controversial step under consideration involves halting deportation for millions, a major expansion of the 2012 Obama program that deferred prosecutions for those brought here illegally as children. Roughly 500,000 have benefited from that program known as Deferred Action for Childhood Arrivals, or the DACA. It goes on to say that if the president wields his pen and commits that unconstitutional act to legalize millions, I think that becomes something that is nearly political nuclear, King said. I think the public will be mobilized and galvanized, and that changes the dynamic of any continuing resolution and how we might deal with that. And this in light of the CNN article that says the death toll passes 1,550 as Ebola outbreak accelerates. Yeah, you remember the Ebola thing, right? I'm sure glad we're not bringing that into the country. Oh wait, we are. The Ebola outbreak continues to accelerate in West Africa and has killed 1,552 people so far, the World Health Organization said Thursday. The total number of cases stands at 3,069, with 40% occurring in the past 3 weeks. However, most cases are concentrated in only a few localities. The outbreak, the deadliest ever, has been centered in Guinea, Sierra Leone, and Liberia, with a handful of cases in Nigeria. The overall fatality rate is 52%, the WHO said, ranging from 42% in Sierra Leone and 66% in Guinea. Well, despite the crisis at the border, at least there's no chance of any illegal immigrants bringing in any of these diseases. ABC 15 out of Arizona reports that undocumented immigrants are bringing diseases across border? Boy, I really didn't see that coming. McAllen, Texas. There's a growing health concern with hundreds of illegal immigrants crossing over into southern Texas. U.S. Border Patrol agents are worried that what's coming over into the U.S. could harm everyone. This time, the focus is not on the women and children that are crossing over in droves. Agents are worried about a viral outbreak. We are sending people everywhere. The average person doesn't know what's going on here, said Border Patrol agent Rio Grande Valley Union Representative Chris Cabrera. Cabrera says agents are seeing illegal immigrants come over with contagious infections. So they're bringing over illegal immigrants with contagious infections and they're shipping them everywhere? This can't be happening. Detention centers and holding facilities have quarantined areas for those who come in sick, but Cabrera says the sick and healthy are separated only by caution tape. This just in, caution tape is the new standard in preventative measures for the spread of diseases. There's been an outbreak of scabies that's been going on for the past month, Cabrera said. Texas border resident George Garcia says word about the contagious skin infection is getting around. Our Border Patrol agents check on us all the time, and they told us about the outbreak of scabies, Garcia said. Cabrera says the sickness doesn't stop at scabies. We are starting to see chickenpox, MRSA, staph infections. We are starting to see different viruses, Cabrera said. Garcia believes the viruses are not contained to the detention center. Not long ago, a group of border crossers came knocking on his door. It was a 7-month-old baby. It was shaking. It had a fever, Garcia said. The Department of Homeland Security called in Coast Guard medics to help treat those who are sick. But Cabrera doesn't believe the federal government is doing enough. He says other Border Patrol agents have contracted scabies, and he fears it will spread quickly. It's contagious. We're transporting people to different parts of the state and different parts of the country, Cabrera said. Just the fact that we are exposed to it, and so is everyone here in South Texas, it's a great concern to us, Garcia said. It's unclear how many were treated for illness. DHS denies all requests for interviews with doctors and medical staff treating sick immigrants. The agency has also turned down our request for a tour. They only released this statement. DHS has public health controls in place to minimize any possible health risks. Throughout the RGV sector, we are conducting public health screens on all incoming detainees to screen for any symptoms of contagious diseases of possible public health concern. U.S. Border Patrol has established medical units at its busiest border stations, McAllen, Weslaco, and Fort Brown, handling UAC. Coast Guard medical teams are assisting with the screening process and providing healthcare evaluations for the sick and injured. Health and safety guidance has been provided too for CBP personnel in the handling of subjects with signs of health-related symptoms. Our workforce has been provided and encouraged to use personal protective gear, including latex or non-latex gloves, long-sleeve shirts, and to take precaution, including frequent hand washing. So as long as DHS keeps people separated by caution tape and people thoroughly wash their hands, shipping all these diseased illegal immigrants to different parts of the country will completely prevent disease. Good to know. And then there's this article out by a WND where Dr. Elizabeth Lee Viet warns of global array of viral illnesses. Dr. Elizabeth Lee Viet, MD of the Association of American Physicians and Surgeons. Ebola, chikungunya, dengue, norovirus, hantavirus, swine flu, varicella, variola. The names sound like something out of a sci-fi movie, yet threats to Americans are real and escalating by the week. The Department of Homeland Security, or DHS, reported on August 1st that serious diseases are spreading at detention centers for illegal border crossers, healthcare workers, and Border Patrol agents. Plus, their children have tested positive for tuberculosis, swine flu, chickenpox, lice, and scabies. Instead of being quarantined, illegal border crossers are being dispersed rapidly across the U.S., with those of school age being registered in public schools opening soon for all. Great news, folks! Sick illegal immigrant children coming to a school near you! Be sure and pack your kids with some of that disease-resistant caution tape we've been hearing about. The Border Control Council reports that 75% of illegal border crossers are from countries around the globe, others from Mexico. They are bringing diseases not common to or eradicated from the U.S. Multiple drug resistance, TB, MDR-TB, is spreading in India and Pakistan. Illegals from those countries have been identified coming across our southern borders. On July 23rd, China announced it had sealed off the city of Yemen due to the deadly outbreak of bubonic plague. Chinese are so numerous in the current surge of illegals that the federal government has added Mandarin translations to emergency signs across the Texas border regions. Mexico has serious outbreaks of dengue fever, which can produce debilitating physical and neurological effects, and also has more severe and deadly hemorrhagic forms. Deadly Ebola hemorrhagic fever is raging out of control in multiple countries in West Africa. Border Patrol agents confirm that West Africans have been apprehended coming via Mexico into the Rio Grande Valley in Texas, with a number of seriously ill individuals whisked away to undisclosed locations for treatment of undisclosed illnesses. ABC News reported in mid-July that seriously ill illegals were flown from Texas to Ventura Naval Base recently with high fever, respiratory difficulties, and coughing blood. At least 3 required ICU admission. No information was released on what illnesses was diagnosed, but the time course, severity of symptoms, and need for immediate ICU treatment is not typical for tuberculosis and more consistent with Ebola or hemorrhagic forms of dengue fever. Ebola is one of the most lethal diseases we face, with a death rate from 60 to 90% of infected patients. It is a horrible death as the virus attacks the blood vessels, leading to hemorrhagic internally and externally. There are no good treatments or vaccines. Ebola's use as a weapon of terror and mass destruction has been documented by globalsecurity.org, which reports that the former Soviet Union biological weapons program had weaponized the Ebola virus, and that Aum Shinrikyo, the Japanese terror group, recently sent members to Africa to harvest the virus during an outbreak. So fasten your seatbelt, folks, as America becomes ground zero for illegal immigrant takeover and infectious diseases. Look for them in your local school, mingling with your children. Well, that's it for this episode, and as always, if you enjoyed, please like and subscribe, and I will see you on the flip side.